If you're wondering whether you should start working out again with a lumbar bulging disc, it can feel like every expert is saying something different. One person tells you to avoid the gym completely. Another says you should strengthen your back as soon as possible. So, how do you know which advice is actually right? Today, we're going to clear all of this up. The truth is, for most people with a lumbar bulging disc, you can get back to working out, but only if you do it at the right phase of recovery and choose the right exercises. That's exactly what I'm going to cover today. In this video, I'll show you when it's safe to return to the gym, what exercises to avoid, how to safely introduce upper and lower body training, and the warning signs that tell you to stop before you make your symptoms worse. Keep watching. This may be one of the most important videos you watch about safely returning to the gym after an L4-5 or L5-S1 disc bulge. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. The short answer is yes. In most cases, you can absolutely get back to working out with a lumbar bulging disc. But there's one important catch. It has to be the right exercises at the right time and in the right phase of your recovery. One of the biggest fears I hear from patients is, I'm scared that if I go back to the gym, I'm going to make my disc worse. Or on the other hand, some people are just as worried about losing all of the strength and muscles they've worked so hard to build. If that's how you're feeling, that's completely understandable. The good news is that returning to the gym is not the problem. More often, it's returning too soon or trying to pick up exactly where you left off at the wrong time of your recovery. Your disc may still be healing, your supporting muscles may not be ready yet, and certain movements can place much more stress on the injured area than you realize. Think about it this way. If you sprain your ankle, you wouldn't expect to run a marathon the following week just because the swelling had started to settle down. Your lower back and discs are no different. Just because the pain is improving doesn't automatically mean the disc is ready for heavy lifting, twisting, or high impact exercise. The goal isn't to avoid the gym forever. In fact, long term, that's usually the opposite of what you want. Strong muscles around your spine play an important role in supporting your lower back and helping you return to activities you enjoy. The key is making sure you rebuild that strength without repeatedly irritating the healing disc. That's why I don't tell my patients to base their recovery on how many weeks have passed since their injury. Instead, I want them to pay attention to how their symptoms are behaving. Your body will usually give you a much better information than the calendar. So, before we talk about which exercises are safe and which ones you should avoid, there's one question we need to answer first. How do you know when your bulging disc is actually ready for you to start working out again? One of the biggest mistakes I see is people using time as their guide. They'll say, it's been 6 weeks, so I should be ready. Or my friend was back in the gym after a month. But that's not how disc injuries work. Your recovery isn't determined by how many weeks have passed. It's determined by how your symptoms are responding, because your symptoms tell us how your disc is healing. Before I give a patient the green light to start working out at the gym again, there are several things I want to see. First, your lower back pain should be significantly reduced, ideally around a 1 out of 10 or less, with 10 being the worst pain imaginable. I also want to see that your antalgic or pain avoiding posture has returned to normal. In other words, you're no longer leaning to one side or holding yourself in an awkward position to avoid pain. The tenderness in your lower back should also have improved, and you should be ready to comfortably bend forward, lean backward, bend side to side, and even rotate your trunk without reproducing your usual back pain. Just as importantly, if you've been experiencing pain, numbness, or tingling down your leg, I want to see those symptoms start to centralize. Centralization means those symptoms are moving out of your leg and becoming more localized to your lower back. That's an encouraging sign that your disc is placing less pressure on the nerve. Once you're seeing those improvements, we can begin introducing exercises again, but not all at once. The key is progressing through the right phase of recovery so you build strength without setting your recovery back. Now that you know when it's generally safe to start thinking about returning to the gym, the next question is how to do it without setting your recovery back. Another common mistake I see is people treating every phase of recovery the same. They either avoid the gym for months because they're afraid of making things worse, or they jump straight back into the workouts they were doing before their injury because they're finally feeling better. Neither approach is ideal. Instead, I want you to think of your recovery as a progression through 3 distinct phases. Each phase has a different goal, a different level of healing, and different exercises that are appropriate for your upper and lower body. As your symptoms improve and your disc becomes more tolerant to movement and loading, you'll gradually earn the right to progress to the next phase. This approach gives your injured disc time to continue healing while rebuilding your strength, stability, and confidence. More importantly, it reduces the chance of irritating your symptoms and helps you return to the gym in a way that's both safe and sustainable. Let's start with the first phase, when your disc is still highly irritated and your main priority isn't getting stronger. It's creating the environment for your recovery. The first phase is what I call the acute recovery phase. This is when your disc is at its most irritated and inflamed. Your lower back pain is usually constant and movements are painful. Your spinal nerves may be pinched or compressed, causing shooting pain, numbness, or tingling traveling into your buttock, thigh, calf, or even your foot. This is not the time to push through workouts or try to maintain your previous fitness level. During this phase, your goal isn't to get stronger. Your goal is to calm the irritated disc and allow it to begin healing. For your lower body, I don't recommend returning to the gym yet. Instead, focus on short, comfortable walks throughout the day, gentle movements that keep your back from becoming stiff, and the exercises your chiropractor or physical therapist has prescribed, such as seated pelvic tilts, prone lumbar extensions, and the cat-camel stretch. These gentle exercises help restore movement, reduce stiffness, and encourage healing without placing excessive stress on the injured disc. For your upper body, I also recommend avoiding traditional strength training. Many people assume that because they're only training their arms or their chest, their lower back isn't involved. But even exercises like overhead presses, bent over rows, bench press, or standing curls require your spine and core muscles to stabilize your body. When your disc and nerve is highly irritated, those forces can be enough to aggravate your symptoms. This is also the phase where it's most important to listen to your body. If an activity causes your pain to become sharper or sends symptoms further down your leg, your disc is telling you it isn't ready for that level of loading yet. Once your pain begins to settle, your movements become more comfortable, and your symptoms start centralizing, you're ready to move into the next phase, where we can safely begin rebuilding strength. The second phase begins once your symptoms have started to settle. As mentioned before, a 1 out of 10 or less. By now, your leg pain has disappeared, your lower back pain is minimal, and you're moving without pain and with more confidence. This is the phase where many people get excited because they're finally feeling better, but it's also where many people make the mistake of progressing too quickly. During this phase, your goal is to rebuild strength while continuing to protect the healing disc. That means choosing exercises that challenge your muscles without placing unnecessary compression or excessive movement through your lower back. For your lower body and core, this is where you begin to introducing exercises like bird dog, side plank, glute bridge, box squat, wall squat, and the Palloff press. These exercises strengthen your quadriceps, your hamstrings, glutes, core, and the muscles that help stabilize your spine, all while keeping your lower back in a much safer, neutral position. Wall squats and chair sit-to-stands are especially helpful because they reinforce proper squat mechanics while limiting how deep you go, reducing unnecessary stress and compression on your healing L4-5 and L5-S1 discs. For your upper body, start with exercises where your spine is fully supported. Machines like chest press, chest supported row, and lat pull down are excellent choices because the bench or chest pad minimizes the amount of stabilization your lower back has to perform. The goal is to strengthen your upper body without asking your healing disc to work harder than it needs to. As you perform these exercises, pay close attention to how your body responds over the next 24 hours. Mild muscle soreness is completely normal, but an increase in your familiar back pain or the return of symptoms traveling down your legs is not. If that happens, it's a sign you've progressed too quickly and need to reduce the weight, modify the exercise, or wait a little longer before trying again. Once these exercises become comfortable, your daily activities are pain-free, and you can tolerate light resistance without an increase in symptoms, you're ready for the final phase of returning to full gym training. The third phase is where most people want to be, but it's important to understand that this isn't about returning to the gym exactly as you left it. It's about earning your way back to full training. Before entering this phase, your lower back pain should be completely gone. Your leg symptoms should have resolved, your mobility should be back to normal, and you should be able to perform your phase 2 exercises comfortably without increasing your symptoms during or after your workouts. For your lower body, you can now begin introducing more functional strength exercises like split squats, reverse lunges, step-ups, leg extensions, hamstring curls. These exercises help rebuild lower body strength, balance, and stability while placing much less compressive force through your lower back than traditional barbell squats or heavy deadlifts. They also prepare your legs and hips for more demanding daily activities without unnecessary overloading your healing disc. Throughout every exercise, keep your spine in a neutral position, move in a slow, controlled manner, and focus on proper technique rather than rushing to lift heavier weights. For your upper body, you can begin progressing from supported machine exercises to movements that require your core to naturally stabilize your body. Exercises like standing dumbbell bicep curls, standing tricep extensions, dumbbell lateral shoulder raises, upright rows, and push-ups are all appropriate, provided you can maintain good posture and keep your spine stable throughout the movement. As you become stronger and more confident, you can gradually reintroduce more challenging exercises. But remember, progression should always be based on symptom response, not your ego or how much weight you used to lift before your injury. Increase only one variable at a time, whether that's the weight, the number of repetitions, or the number of sets, and give your body a chance to adapt before progressing again. The goal isn't simply to lift heavy again. The goal is to build a stronger, more resilient back that allows you to stay active without repeatedly irritating your L4-5 or L5-S1 disc. Now that we've covered what you should be doing, let's talk about what you should avoid, especially while your disc is still healing. In general, you want to avoid exercises that significantly increase compressive, bending, or twisting forces through your lumbar discs. During recovery, these forces can increase pressure inside the injured disc, delay healing, and increase the risk of further injury. These include heavy barbell squats and conventional deadlifts, which place substantial compressive loads throughout the lumbar spine. Sit-ups, crunches, toe touches, and repeated forward bending should also be avoided because they have repeatedly flexed the lower back, increasing pressure on the back portion of the disc where bulges commonly occur. Twisting exercises, especially when combined with weight, can further increase stress across the injured disc and the surrounding tissues. One exercise that often surprises people is the leg press. Although your back is supported, bringing your knees too close to your chest causes your pelvis to roll backward, placing your lumbar spine into flexion while it's under a heavy load. This significantly increases pressure within the disc and can irritate an already healing disc. Finally, avoid high-impact activities like running and jumping until your disc is fully recovered and you can tolerate progressive strengthening without increasing your symptoms. Today, we covered when it's actually safe to get back to the gym after an L4-5 or L5-S1 bulging disc, the 3 phases of recovery, which exercises to avoid, and how to safely rebuild your strength without setting your recovery back. Now, I'd like to hear from you. What helped you the most? Was it the 3 phases of recovery or the exercises to avoid? Drop a comment below and let me know. If you found this video helpful, please give it a like and share it with someone dealing with a bulging disc. You never know who might be looking for practical, non-surgical advice to help them get back to doing the things they enjoy. And if you want more videos that help you better understand what is actually causing your pain and what you can do about it, make sure you subscribe to my channel. Now, if you're ready to take the next step, watch this video next. I'll show you 5 gentle exercises you can safely start during phase 1 of recovery to relieve pain, improve your movement, strengthen your back, and lay the foundation for getting back to the gym safely.